Welcome to Paul's Heart. I'm Paul, author of the book, Paul's Heart Life as a Dad and a 35-year cancer survivor, available on Amazon. Today marks one of my many anniversaries that I like to recognize. It is really a big deal. This one is not pertaining to my cancer directly, but rather from an issue that developed as a result of the treatments that I received 36, 37 years ago. So radiation therapy, the amount of radiation that I was given, something that they don't do anymore today, caused some progressive damage to my heart over the years. It continues to do that damage. I had to have an emergency bypass back in 2008, and in 2019 I had another stent placed in one of the major arteries of my heart. But today marks 4 years since I had to have my aortic valve replaced. Now, it's really quite miraculous how this was done. It was through a process called TAVR, trans arterial vascular replacement. Okay? And basically what that means is that instead of going through the chest, they went through an artery up through my leg up to the heart. And are you ready for this? Place this thing right in there. And as you can tell from my fingers, this is rather large. And I will tell you that according to my cardiologist, this is the actual size. Now, this is a replica of the one that was put inside me. The company that makes this valve sends it to their patients as a souvenir. But it's very cool. It boggles my mind how this thing went through an artery in my leg, but basically it does get, so now this is a hard piece of plastic, so it's not going to be flexible. But the one that they replace in my body is just compressed so tightly, sent up through a tube through my leg, and then placed inside my damaged aortic valve. The really cool thing about this one also is that when the time comes that I need this done again, and I'm going to get into what this means, they will be able to actually place another valve inside of this one. This one is large enough to accept another valve that's smaller. So one of the things that comes into making the decision whether you're using a tissue valve, which is usually either bovine or porcine, which is cow and pig, or going with what's called the mechanical valve. The mechanical valve is a valve that's meant to be pretty much permanent, lifetime. Unfortunately, the only option to have a mechanical valve put in is through open heart surgery. So obviously, if you come across where you need to have at least your aortic valve replaced, and again, as I always say, I'm not a doctor, so I'm not going to tell you what to do. But be informed, okay? And if time allows, okay, get a second opinion. It doesn't hurt because this technology is not available everywhere. And then, of course, you've also got to deal with the insurance companies and what they'll allow. But the thing is, doctors will probably try to steer you one way over another. And unfortunately, that's based on age. You know, because of the tissue valve not lasting as long, they don't want to have to go in again and again and again. So if you're younger in age, I was 56 when I got my valve. They were willing to give this to me. So, but there's another quality with the mechanical valve, and that's a noise issue because you can hear the valve clicking as it's working, and that is something that can stress people out. The other thing is blood thinners. Okay, I am on blood thinners with a tissue valve, but with a mechanical valve, you're on a much stronger blood thinner, which can cause an issue with bleeding and having to monitor what's called your INR, which is your clotting factor. Those are all factors that come into dealing with the mechanical valve. I can't make any recommendations on that because I don't have one. But what I can tell you is that if you can avoid having your chest opened, and I have had that done, and having a valve replaced via TAVR, the recovery is, you know, like 30 times quicker, like the next day quicker. So, but yeah, we're not sure how long this puppy will last. On average, they say between 7 and 10 years. There's no really hard numbers for how long these things last, even my bypass. And from the average of that, I'm already past that. So a lot of that has to do with lifestyle and how you take care of your heart once they make these fixes to it. So, as they say, happy TAVversary to me, 4 years today, had my aortic valve replaced. Until next time, this is Pulsar.